Welcome to The Explainer. I'm just so incredibly excited you're here today. We're going to skip our usual agenda and jump straight into a medical case study that is, honestly, as fascinating as it is moving. We're looking at a recent report published in the Journal of Parkinson's Disease. It explores a radically different approach to treating a chronic, progressive neurological condition, and it completely reframes how we think about the intersection of the mind, the body, and modern medicine. So, think about this. How do you treat a disease when the biggest hurdle is just accepting you have it? Right? When we think of chronic illnesses, especially something like Parkinson's disease, we instantly picture the physical symptoms. We think of the tremors, the stiffness, the loss of motor control. But what we rarely talk about is the profound, hidden psychological battle that comes with receiving that kind of life-altering diagnosis. The source data reveals what we call the hidden toll of Parkinson's. This disease isn't just a physical motor issue. It's emotionally distressing for a massive number of patients. And a lower acceptance of the disease becomes a huge obstacle to healthy adjustment. It manifests as severe anxiety, constant negative ruminations, and devastatingly lowered life satisfaction. This emotional distress often leads to depression and, crucially, poor medication adherence. Because, when you're trapped in a state of emotional denial or just paralyzing fear, you simply cannot manage your physical health effectively.
Okay, let's dive into this. Section 1. A patient hits a wall.
Let's meet the protagonist of our case study. She's a 43-year-old woman with a 2-year history of Parkinson's disease, and she's a prime example of everything we just talked about. Physically, she had moderate stiffness, mostly in her right arm, but she actually retained her functional ability. Her physical symptoms were even partially controlled by a low dose of medication. Emotionally, however, it was a totally different story. She was suffering from severe anxious ruminations, intense worries about becoming handicapped in the future, and just an overwhelmingly pessimistic outlook. And because of this emotional block, she was actively refusing to increase her Parkinson's medications or even take anti-anxiety drugs. Standard specialized therapeutic education with a Parkinson's nurse? It wasn't helping her. She had essentially hit a complete medical and psychological wall. Section 2. Enter psychedelic therapy. Because the standard therapies were completely failing to help her cope, she decided to seek out an ancient yet modern alternative approach. Now let's be crystal clear about what this means. Psilocybin-assisted psychotherapy, or PAP, is a highly monitored, structured clinical treatment. This is absolutely not a recreational trip or some unguided experiment. It combines the active psychedelic compound psilocybin, which acts on serotonin receptors in the brain to improve mood and cognitive flexibility, with intense professional psychological support. To understand just how rigorous this intervention is, let's walk through the clinical protocol built around every single session. Step 1 is a preparation meeting. This is absolutely essential to establish a strong therapeutic alliance between the patient and the psychiatric team and to set clear treatment goals before any medication is even administered. Step 2 is the integration consultation, and that happens the very next day. This helps the patient make sense of their subjective, altered state of consciousness and actually apply those insights to their real-world struggles. And step 3 is a 1-month follow-up session to provide extra support and ensure the therapeutic process is really taking root. It's essentially a comprehensive clinical safety net. And keep in mind, this wasn't a quick fix. Her treatment was carefully mapped out over an entire year. With authorization from the Federal Office of Public Health, she received 4 high-dose sessions. Notice how they're spaced out: 10, 24, 38, and 52 weeks. The first 3 sessions used a 25 milligram dose, and the final session used 30 milligrams. Everything was spaced out to ensure maximum safety, measured clinical pacing, and, most importantly, time for profound emotional integration between each session. Section 3. Rewiring the mind. So, what exactly happened during these deeply monitored sessions? How did this ancient compound used in a modern clinical setting actually impact her severe anxiety? Well, she experienced a crucial psychological shift known as decentration. Basically, this is the ability to zoom out and view your own thoughts and emotions as objective mental events, rather than absolute identifiers of who you are. For our patient, who was trapped in this terrible spiral of anxious ruminations about her future handicap, decentration was literally a lifeline. The therapy helped her safely detach from those terrifying thoughts, allowing her to view her fears objectively rather than being utterly consumed by them. Alongside decentration, she experienced a high magnitude of what researchers call oceanic boundlessness. It's a beautiful term, right? It's a feeling of transcendent self-expansion, unity, and connectedness. Instead of feeling dread and isolation about her failing body, she experienced a profound oceanic shift in perspective. She moved from a state of personal existential dread to a much broader, more peaceful, and objective view of her reality. And what's really important here is that the medical team noted she didn't experience any anxious ego dissolution. The sessions were incredibly positive for her.
Section 4, the power of acceptance. Now, the real test of any medical intervention isn't just how the patient feels during the treatment, right? It's how they function long after the medication has completely left their system. Measured a full year after her final session, this number is just remarkable, 20 out of 24. This is her score on the life orientation test, which measures dispositional optimism. Before she started this treatment, her score was a 10. She was deeply pessimistic about her life and her future. But 1 year after completing the psychotherapy, her score doubled to a 20, indicating high optimism. Her anxious ruminations plummeted, her sleep improved, and her overall well-being significantly increased.
Now, what's really interesting about this slide is the contrast in her physical motor skills. Before treatment, her symptom score sat at a 21. A year later, it was a 20, basically unchanged. Psilocybin-assisted psychotherapy did not cure her physical Parkinson's disease. Her right arm stiffness and motor symptoms remained functionally the exact same. But here's the kicker. While her physical reality didn't change, her relationship to that reality completely transformed.
And this brilliantly illustrates the emotional core of her transformation. A year later, she summed it up perfectly. She said, "I have accepted that PD is part of me." The therapy unlocked difficult-to-access emotions, reduced her avoidance, and facilitated this massive cognitive restructuring. She learned to prioritize her personal well-being and actually appreciate the present moment rather than just constantly living in fear of the future.
Which brings us to the real medical plot twist of this case study. Because the patient finally achieved emotional acceptance of her disease, she was actually able to achieve pharmacological acceptance. Remember how she was refusing to increase her Parkinson's medication early on out of denial and fear? Well, with her new mindset, she willingly agreed to adjust her dopaminergic treatment. At her 1-year follow-up, she willingly agreed to a comprehensive regimen of standard Parkinson's medications to finally manage her physical symptoms. Healing her mind allowed her to finally treat her body. Section 5. The future of psilocybin.
This single case report is a powerful testament to holistic medicine, but what does it mean for the wider medical community? Well, the authors of the study are very clear about the next steps. First and foremost, a single case report is not generalized proof for an entire population. There is an urgent need for broader, randomized controlled trials to really confirm these incredible results. Second, the implementation of these studies relies heavily on ongoing efforts by the United Nations to reclassify psilocybin as a non-addictive substance, recognizing its true therapeutic potential. And finally, it points to a necessary shift in how we handle chronic illnesses, moving from purely physical symptom management to fostering deep emotional integration and resilience.
I want to leave you with this final provocative thought. Could treating the mind be the ultimate key to living with a chronic illness? This patient's body still has Parkinson's, but her mind is no longer a prisoner to it. By addressing the severe emotional distress of her diagnosis, science helped her find the optimism and strength to truly live her life again. It's a stunning reminder that sometimes the most profound medical breakthroughs don't just change our bodies, they change how we see the world. Thank you so much for joining me for this explainer. Keep asking questions, keep exploring, and I'll catch you next time.